Welcome to Richmond Wellbeing Documentation Training. The purpose of documentation training is to learn a simple format to follow when writing notes. It is also important to gain consistency in note writing across Richmond Wellbeing sites. What is the purpose of documentation? Documentation provides a crucial record of a person's journey in our services. It has a role in record keeping of activities undertaken as part of recovery, and it constitutes a legal and ethical responsibility for Richmond Wellbeing. Why is documentation so important? Firstly, it keeps staff who are involved with a client or a person up to date. It communicates information across teams and services. It provides a source of historical information to guide our future work with people. And it provides a record of service delivery for accountability. Important. Documentation is a medico-legal requirement. All information pertaining to an individual can be called upon in a court of law. So for this reason, documentation needs to be taken very seriously. What are progress notes? Progress notes are a brief written description in the person's record each time services are provided. Generally, they reflect one unit of work, such as a shift. Progress notes provide a record of the person's recovery journey. The notes outline the work being done by the person themselves and by staff in relation to the person, what's helped, what's not worked, or other ideas to try. Here are some points to consider. Progress notes are professional documents and therefore must reflect an appropriate level of professionalism and astuteness. Professionalism does not mean that notes should be clinical. Recovery language should still be written professionally. When documenting, consider who the audience is and what information will be most relevant to them. Ask yourself if the information is relevant every time. Plan what you are going to say before you start writing, and refer to the SOAP notes, which are later in this presentation, to help you structure and assist you with your plan. Always reread and proof what you have written and check it would make sense to a third party. If in doubt, remove parts that are unclear or do not make sense. It is good practice to use short sentences and break up text into smaller parts. Avoid having big chunks of information that appear as slabs of text. Consider that this is a recovery document. Can you see the recovery approach reflected in the way it is written, who has contributed, and in the content? What is co-authoring? Co-authoring means writing together. Your notes should be discussed with the person and written together as much as possible. Confidentiality. No unrelated information should be included. This includes names of members of the public and other people who use the service. Initials are okay when necessary. Names of staff involved, other professionals involved, and relevant family members can also be included. Authorship. Use the pronoun I rather than job position or author. For example, I had a conversation with James. If you are a relief staff member, include your name and position at the end of the entry. For example, Jane Smith, relief recovery worker. Always include the time. At the beginning of your entry, even though it is in CareLink Plus, include the time of the entry or the time you're referring to, and use the 24-hour clock. For example, 14:30 for 2:30 p.m. Bob came to the office and asked me for details about the social event later in the week. Here are some of the basics of writing progress notes. Use full sentences. Check spelling and punctuation. Use approved abbreviations only. Bullet points can be used when appropriate. Use clear and simple language. Be concise and don't use jargon. Notes should be person-centered and related to the person directly, including only what is important for them and their goals. Notes must be relevant. Try to avoid including unnecessary or unrelated information. Keep your notes concise whilst covering all relevant information. Content in notes must be factual and details should be recorded correctly. Avoid using anecdotes from others. Notes must record observations, not speculation or assumptions. Notes should always be recorded in a timely manner. It is preferable to complete notes as soon as possible to the event that is to be documented. Language in progress notes. Language should always be respectful and non-judgmental. Use everyday language as much as possible. All written records will focus on a humane recovery manner of expression and will not reflect jargon or over-medicalised appreciation of a person's recovery journey. And that's straight from the policy document on documentation of consumer information policy, which can be found on the intranet. Notes should be objective. Write your observations in a factual manner. Observations are reasonably indisputable facts of action, appearance, or statement. Things to avoid. It is not appropriate to write something about a person that you would not want them to read. Further things to avoid in notes. For example, Charlie has been compliant with her medications, but there has been no remission in her symptoms. The problem with this statement is that this is not a qualified statement about recovery. Another example would be, Charlie was her usual self today. The problem with this statement is that it does not provide any information and is not backed up by an observation of the person themselves. It also doesn't say anything about what usual is, and also usual is not a qualified statement that we would make in relation to a person's state at that point in time without having any further evidence. Here's another example. Charlie was great fun to be around today. She cheered up everyone in the group and I really enjoyed her company. The problem with this statement is that the wording is not really appropriate and it lacks detail as an observation about what happened. It's also not a recovery statement and it involves a comment about the worker themselves in terms of enjoying her company. This would not be appropriate in our consumer information policy. A further example, Charlie lacks insight into her self-care. She needs constant reminders and is becoming increasingly more lazy. The problem with this statement as well is that it is not recovery language and makes a judgment about Charlie being lazy. It doesn't give us any information about where Charlie is in her recovery journey or how the perception of her self-care has anything to do with recovery itself, or that it is a goal-oriented issue that we are working on together. And here's another example. Charlie was angry and abused me repeatedly during the shift by yelling at me and calling me horrible names. The question here is, how do we know Charlie was angry? What did we observe? And state what happened and why it happened, if possible. Another example, Charlie was fine today, no concerns. The problem with this statement in the notes is that for a person reading those notes, it might be a site supervisor, and the perception in this case could be that there's no recovery or support work that has been provided. We need to write what's happened. How do we know the person is fine? What have we observed or what have we undertaken with that person in that episode or that period of time during the day? Notes should always be written using objective language. This includes observations, and even though observations should be objective, we do interpret those observations. So there is some interpretation, but the more clear and concrete we can be about what we've observed, the more clear it is for another person reading it and the less chance there is that it could be misinterpreted. For example, I saw Charlie huddled over and I could hear her crying. We're not making a statement about her state of mind at that time, we're just writing what we've observed. It is best to use observation, not interpretation. If we make a claim about someone's emotional state, it needs to be clarified. For example, I observed Charlie to be upset. She was huddled over and I could hear her crying. Here is an introduction to the use of SOAP notes. The use of SOAP notes has been widespread in health and medical fields for many years. We are using SOAP to establish consistency across sites. SOAP is a format for writing notes. The acronym stands for subjective, which is through the person's eyes, objective, which is through your eyes, preferably without your judgment, an assessment or action, which means what has been done or what has happened, and the plan. So what actions are planned for moving forward? Why do we use the SOAP format? SOAP notes are used to assist in continuity across a person's notes by enhancing communication through consistency of approach. Subjective. Subjective in this context refers to the person's report of how they feel and how they are going. It may include other facts rather than opinions about the person or situation which have been provided by family members or professionals. Objective. Objective refers to what you have noticed about the person. For example, Simon was positive and participated readily in our discussion. He focused on our conversation for the full 30 minutes. Assessment or action. Action refers to what happened in the meeting or interaction and what was done. For example, Simon and I discussed Simon's recovery plan. Simon said that he is thinking a lot about his progress and his goal to find volunteering work. Simon asked for information on how to apply for part-time work. Plan. The plan consists of a few sentences of what will be done between this and the next meeting. For example, for our next meeting on Thursday, 16th October at 2 p.m, I will bring some website addresses which provide information on getting work and information to help Simon update his CV. Simon will note down the things that he has done over the last 18 months and find his certificates to go towards his CV. Example of a completed note. Simon said that he has had a difficult week but feels okay. When asked about what had been difficult, he explained that he was worried about getting a job in the future. Simon was positive and participated readily in our discussion. He focused on our conversation for the full 30 minutes. Simon and I discussed Simon's recovery plan. Simon said he was thinking a lot about his progress and his goal to find volunteering work. Simon asked for information on how to apply for part-time work. For our next meeting on Thursday, 16th October at 2 p.m, I will bring website addresses which can provide information on getting work and information to help Simon update his CV. Simon will note down the things he has done over the past 18 months and find certificates to go towards his CV. This is a brief introduction to documentation. For more information about notes and documentation, please refer to the Documentation of Consumer Information Policy on the RW intranet. If you have any questions or comments, please send us an email to training@rw.org.au. Once you've completed the training, please complete your training evaluation form and scan back the copy with other training records to that same address, training@rw.org.au. Thank you very much.